Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about alcoholism and its devastating negative effect on the human body. In this segment, I'm going to wrap up the series because this is show number 10, and I'm going to summarize just about everything for you. There is all organ in the human body can be affected in a negative way by the effect of alcohol. Alcohol abuse is a very bad disease. 50% of individuals who abuse alcohol, they do so because of a genetic component in their history tree, family history tree that causes them to wind up abusing alcohol. The rest is environmental. Across the world, more than 2 million people use alcohol to one degree or another. 1.4 million people, however, abuse alcohol across the world. In this country, some 18 million people are classified as alcoholics, and many more millions have not been classified, but they also abuse alcohol. I want to give you a racial and breakdown as well as some kind of a breakdown of male versus female as to who in this country abuse alcohol. In this country, you have 61% of white female abuse alcohol, 38.6% black female use alcohol, 74.2% white male use alcohol, 62.6% black male use alcohol, 38.6% American Indian slash Alaska Native use alcohol, 30.1% Asian use alcohol, and 30.1% Native Hawaiian and Pacific Islanders also use alcohol. 38.4% Hispanic female. No, wait a minute. 69.9% Hispanic male abuse alcohol, and 49.25% Hispanic female use alcohol. So this is a very prevalent problem. However, in order for your system, in particular the liver, to really get damaged by alcohol, you must consume 80 grams of alcohol daily on an extended basis. That's the cutoff point, 80 grams of alcohol daily on a continuous basis over long periods of time. That's when your liver begins to get damaged. The alcohol, by necessity, when you drink it, must go through the mouth, through the esophagus, down into the stomach, into the liver. And the liver has many jobs. Among it, of course, it has to try to detoxify the alcohol. So, as I mentioned before, all organs in the human body can be affected by the chronicity of abusing alcohol. I spent several shows the last few weeks talking about the effect of alcohol on the liver, the effect of alcohol on the brain, the effect of alcohol on the heart, the effect of alcohol on the GI tract, in particular the esophagus, the stomach, so on and so forth, on the spleen, the effect of alcohol on the hematopoietic system, namely the blood system. Extensive discussion that I went into explaining all these things. How one goes about treating somebody who presents in the emergency room who's an alcoholic. Got to be very careful. This individual present. You must be very careful to examine the inner ear, examine around their head very carefully, so that examine the mouth, because they could have been traumatized. And one of the best prudent thing to do is to do a CT of the head, because you don't want to send somebody home from your emergency room only find out that they go back home, they go to sleep, they didn't wake up because they had bleeding into the brain that you didn't pick up because you failed to do a CT of the head for subdural hematoma, peridural hematoma, and so on and so forth. So those are crucial things to remember. In addition to that, when the individual shows up and the emergency was an alcoholic, there's a whole protocol that is set up what to give them every single time an alcoholic shows up in the emergency room, in addition to examining them, talking to them, because first of all, they're likely to not have been eaten properly. So you have to give them the so-called alcoholic cocktail that includes sugar, 1 ounce of glucose, but you cannot give the 1 ounce of glucose without first giving thiamine, because these people are deficient in thiamine. Because they're deficient in thiamine, when you give the glucose, the Krebs cycle cannot function properly, and because of that, the sugar sits there, and because they get the sugar, if you don't give them thiamine, whatever little bit of thiamine that's left to make the Krebs cycle function to use up the sugar is being used up acutely, and then they go into Wernicke encephalopathy. That's a catastrophe. So to avoid that, you follow the protocol. You give them the amp of, after you evaluate them, you get your blood test, all that stuff is gone. Give them 1 amp of sugar, you give them some thiamine, you give them vitamin B complex, you give them folic acid, and you give them Ativan to try to prevent the agitation if they are agitated. They may not appear to you to be agitated, and obviously you're going to send an alcohol blood level, but be careful, because these people, some of them are walking around with alcohol blood level that is over 300, and they're okay with that. That will put people who are not alcoholic to sleep and into coma. They're okay with that. Just because the alcohol level is that high doesn't mean they cannot go into alcoholic seizure. They might, because when they present, if they haven't, especially if they stay in the emergency room a long time, they need the alcohol. If they can't get the alcohol, then they can go into detox. They can get into all sorts of problem that's going to happen to them because of the alcohol that they need. And I describe for you in this book and the other books that are in front of me the step-by-step way in which they can go from being agitated to starting to go into seizure and to go into coma. So you got to keep your eyes on them, make sure the nurses check them every hour on the hour to make sure that they're not going into this, because if they go into alcoholic coma, they may or may not recover. Some of them do, but many of them don't. And you don't want them to go there. And so you have to be watching them. And then of course you want to check everything. You want to do a blood count, get the complete metabolic profile, check the urine to make sure there's no blood in the urine. Trauma may have occurred to the kidney. Make sure you get your chest x-ray, get your EKG to make sure that they're not having some acute cardiac problem, and so on and so on. This is serious business. So this is not something to take lightly. Alcohol abuse is a very bad psychological, psychiatric, / medical problem. And these individuals need help. They need help not only to help them with the acute problem, but they need help to send them to AA and other organizations such as AA that's going to consult them for years. This is not a quick and fast thing. And depending on the abnormalities they're suffering from, then you have to handle each problem individually. If they have bleeding because of esophageal varices, then you got your handful, because your esophageal varices, once they stop bleeding, it's a very difficult thing to get them to stop. So and if you discover that they have esophageal varices, there are medications such as beta blockers that can help to some degree to lower the portal pressure. Because once they become cirrhotic, the damage that occurs within the substance of the liver create blockage of the vessel, then the liver is going to try to bypass that by creating neovascularization on the wall of the esophagus, and then that's esophageal varices. And those things are very fragile. They can bleed spontaneously at any time, and the bleeding can be massive. In addition to that, they wind up with elevated portal pressure. Well, since the portal pressure is high, the spleen is going to become enlarged. Once the spleen becomes enlarged, then the platelet is going to be low because of that. The white blood cell is going to be low because of that. and inevitably they're going to start hemolyzing, so which means the red blood cell is going to be low. So they have all these three problems simultaneously. So you must keep these things in mind. So these are crucial things to pay attention to acutely and chronically. Last week, I went over the whole concept of individuals who have secondary iron overload because of the inflammatory processes that's taking place in the liver. They can, so therefore, even though they're packed with iron in the liver and elsewhere, the serum ferritin is very high, they have iron deficiency. You say, well, Val, how can somebody has a serum ferritin of 500, 600, sometimes 1,000? You say, yes, they're iron deficient because they cannot use the iron. That's it. If you cannot use the iron, they're iron deficient. The iron is back up, the iron is there causing damage to different part of the body, but the place where the iron is needed the most, which is in the bone marrow, is deficient there. So therefore they have, this is a form of iron deficiency. Iron deficiency is not just because you bleed chronically and you lose iron. Yes, that is iron deficiency. We know how to diagnose that. We know how to evaluate that to make sure we figure out why the person is bleeding chronically. But when you have a pile of iron that's piling up somewhere in the body, you can't use it. Technically speaking, you're also iron deficient because you cannot use it. Yes, there is iron, but it's located in the wrong part of the body. And I tried to explain to you last week how to mobilize that iron. This is completely different from people who have iron overload because they're sicklers or they have thalassemias. Yes, these people are hemolyzing, but we handle those iron overload differently as opposed to somebody who have secondary hemochromatosis, because everyone, doesn't matter who they are, who have chronic inflammatory diseases in the system, such as rheumatoid arthritis and a whole host of other, these people have too much iron. And that iron is very damaging to wherever the iron sits. Because once the iron sits somewhere, by necessity, it must degrade. As the iron is degrading, it's releasing free radicals. The free radical is the first step in the formation of chronic inflammatory processes. So therefore, the inflammation that causes the iron to back up in the first place is now being made worse by the fact that the iron is also degrading, adding up to the inflammatory processes. And you just simply have to understand this mechanism so as to how to help the patient. Because you have a patient who is deficient, you can't just keep pouring blood into them because each unit of blood has 250 milligrams of iron. You have to have enough knowledge to know, how do I mobilize this iron? Well, the way you mobilize it, like I said last week, you give them epogen. The epogen inevitably is going to push the iron across the area where it's being blocked. Just overcome the block and dump it into circulation, because the ferritin receptors are sitting there waiting to grab onto that iron, to take it into the bone marrow to be incorporated in erythroblast, which is baby red blood cell. This way, you make new red blood cell to improve the anemia. But this is not something that you could just come from the top. You have to have learned this stuff. This is stuff that I went to one of the best medical schools in the country, top 22% medical school in the country, one of the best training programs in the country. They were fantastic. They educated me very well. But I did not learn this stuff from them. That knowledge was not available in those days. You say, well, Val, where do you get this knowledge? I get this knowledge because I read about it. I research it. I teach. I must know what I'm talking about. So to sit here and tell you that 80% to 85% of what I do every day, I taught myself, that is not a negative statement about my medical school. It's a great medical school. That's not a negative statement about my training program. Monica, it's a fantastic training program. These people didn't know that stuff. That's just the way medicine is. Every single day as I speak here, new things are happening. But if you are a writer of medical books like I am, you are a medical educator, you must keep up with what's going on. As you keep up with you're learning new stuff. You're teaching yourself. So I can explain it to you. I can explain it to my student, explain it to young people that I place in my here. It's a privilege to teach them. But I don't have a monopoly to this information. Every single thing that I'm telling you is out there somewhere. You just have to know where to find it. Yes, there are many ideas that I came up with myself that have been proven to be correct because that's the kind of brain God gave me. And I'm not going to sit here apologize for it. No way. I mean, God has done a fantastic thing to me. Am I going to sit here and apologize for the fact that I lost my mother when I was 7? There was nobody there to help me. I helped myself. Am I going to apologize for the fact that I had to come to this great country to went to PS 44 when I was 26 years old to get my elementary school diploma? No, because this country does that for me. I was telling people earlier that this is the only country that I'm aware of in the world that would have allowed someone like me with this horrible beginning that I had to allow me to get as far as I have gotten. It's incredible. But this is America. The door was open. I worked very hard. I struggled to get to this country because I wanted the classroom. Because I know once I got in the classroom, nobody, let me repeat, nobody can beat me in the classroom. That's right. And I've proven that to be correct. And that's all I wanted. And I got it. And I took full advantage of it. Was it easy? Of course not. I worked 3 jobs. Let me repeat that. I worked 3 jobs when I went to college. So don't expect to get an apology from me. No way. 3 jobs. And I went to college. And I was still on the dean list. That's right. So therefore then, you have got to keep up with what's going on because medicine is moving along every day. Look at this big book right here. It just came out. It must be 6 weeks now. Ow! African American Women's Health. Yeah, don't let the title fool you. Yes, it is African American Women's Health, but it is the book that covers all health problems associated with women of color across the world, no matter what they think of themselves. Because the physiology is 100% different than Caucasian women. People want to be Caucasian, ignoring the fact that they're fooling themselves when they're not, because it's only when they present with major medical problem, they're scrambling all over the place looking for help to find, oh my God is correct. You should have paid attention who you are. Be proud of who you are. Don't let anybody make you be what you're not because your medical problems are different. Your physiology is different. By knowing that, you will do things way back that will keep you in good health rather than absorbing. You have 7.7 billion people in the world. 4 billion plus live in Asia. 1.6 billion live in Africa. That's almost 6 billion right there. How are you going to tell me that the minority in number is going to tell you what to do when the physiology is different than yours and you're going to try to psychologically get yourself messed up by thinking you are who you're not because it makes you look better socially and you get accepted better socially. Give me a break. And you cannot, let me repeat that, I said it and I'm saying it again, you cannot provide high quality medical care for anyone whose ethnicity that you're not familiar with and you're not sensitive to it because the physiology is different. You're kidding yourself. And the AMA agrees with me now because the AMA has given grant to at least close to 40 medical schools right now have taken the grant to change the way they teach medical students and the way they train intern and resident. It is now patient-oriented and evidence-based. You better know this because when you take your exam these days, it's going to be loaded with ethnic-related questions, and you better know what you're talking about, okay? Don't fool yourself. I don't care what you want to do. It's your business. You could pretend to be anything you want to be. But when you come to the reality of it, when you face the music, you got to dance to that music, okay? Okay? You go right ahead. Fool yourself. Make yourself believe you want whatever you want to believe to make yourself look good socially. But you better make sure that when you need quality medical care, you tell people exactly who you really are because your symptoms are different. The diseases that you are afflicted with most frequently are different. The way to go about the diagnose them are different, and frankly, the treatment are different all the time. It is incredible if you don't know these things. Every day, 7 days a week, literally, because I practice by myself in my office, I'm making diagnoses that will make your knee tremble without a $50 billion machine. Only this head that I have over my shoulder and this brain that allows me to know who I'm dealing with, therefore, X, Y, and Z, what to do to make major diagnoses to help people with the suffering every single day. Because I don't mess around. I tell you up front what the story really are. Okay, so suffice it to say, alcoholism is a bad disease. Okay, do not let peer pressure get you into it, because it's very difficult to get rid of once you enter into it, because it's an addicting substance, very addicting. Alcohol is very addicting. A couple of glasses of wine, it's okay. But if you have family members that are genetically close to you that are alcoholics, you may be carrying the same gene that they're carrying that caused them to become an alcoholic. So don't touch that stuff. Refrain from it. Because people who don't have that gene may touch a couple of glasses of wine and know when to stop. It's time to stop. They stop right there. But those who are unfortunately afflicted by the carriage of this gene, they can't stop. As much as they would like to, they can't. They just keep drinking. Okay, and so many highly talented individuals to have a lot to offer to society have destroyed their lives through the effect of alcohol. It is incredible. Talented people that have so much to offer to mankind, and alcoholism has taken it away from them, and from that matter, from mankind, from their family. You have no idea how traumatic, destructive alcohol abuse can be to a family setting. People like me who practice general medicine, who have to deal with families, have to confront these issues every day. For many years, I spent time teaching at 21 Bloomingdale Road, up the street, and right here in Westchester when I was teaching at Cornell. It's amazing to know the incredible, famous people that used to fly their own private plane to the different airports were right there being treated for abuse of one type or another. And these are extremely famous people, wealthy, but they were afflicted with addiction of one kind or another. Addiction is a major problem, be it drug addiction, be it alcohol addiction, because alcohol is a drug. So be careful. And I'm not here pontificating, because no one is perfect. I'm just here as an educator who has the responsibility to tell you these things. I'm not forcing you to do anything. I'm just telling you the facts. So this is the 10th show on alcoholism. There is no organ in the human body, from the skin to the air to the brain, all the way down to the toe, that cannot be affected by the effect of alcohol, and when you abuse it in a chronic way. So all I can say to you is that right now we're dealing with an opioid epidemic in this country, and opioid and alcohol are intertwined, because other people who don't have access to the opioid drug, they resort to alcohol. Because the alcohol, you don't need a prescription to buy it. You could just walk, if you have the right age, you could walk into a liquor store and buy the alcohol. And the damage, not in that to themselves, the damage they do to the public, the accidents. People are being killed all the time because of people who are driving drunk. That's a bad thing. If you know you're going somewhere, you're going to take a couple of glasses of wine, make sure there's somebody who doesn't drink to drive you home. Because you can't drink and get behind the wheel of a car. Not only are you going to hurt yourself, but you're going to hurt other people, innocent people. It has nothing to do with it. The next thing you know, you and your car into them, and they get fractures, they get killed because of your action that you abuse alcohol. Yes, there are situations where they say there's certain substances in red wine that's good for you when you drink them so that your platelet doesn't aggregate. Therefore, they said it's good for your cardiovascular system. Yes, lately some article came out say something to the contrary. Suffice it to say, alcohol abuse is bad. Alcoholism is a bad disease. You don't want to be associated with that. And if you do have a problem with it, seek help. Get yourself enrolled into AA and other organizations like AA to help you to give it up. If you need help from a psychologist, get help. Need help from a psychiatrist, get help. There are certain medications that are out there that can be used to help you as well. And general internists such as myself can go a long way in helping you with these things. So all I can tell you is the fact that it's a bad thing to become an alcoholic, as it is a bad thing to become an opioid abuser or a drug addict and all the rest of it. This book has a big chapter on alcoholism, has a big chapter on drug addiction, has a big chapter on depression, big chapters, all there. So if you can get your hand on this book, both this one that I wrote in 2016, The Art and Practice of Modern Clinical Medicine, there are chapters on there on all these things. All I can tell you is the fact that I've done the best I can to expose you to all the things that I know that are taking place in the alcohol abuse issue for the last 10 shows. I can do 10 more shows on alcoholism if I wanted to, but I won't. I made all the main points that I wanted to make. The rest of it is you, your family, your counselor, your physician to help you to try to do without this stuff because it is damaging. I know it's easier said than done, but what are you going to do? You can't keep destroying yourself. If you need help, seek help. Don't function in a denial state. Admit to yourself that you have a problem and seek help. Listen, I'm going to stop here. Next week, I'll find something else to talk about. Until such time, keep watching the show. It's Dr. Alcena saying so long and bye-bye.